So, Cassie, is there any other questions after your cleaning today?
Yes, actually I'm interested in whitening, but I don't really think or know if it's right for me.
Okay, well, whitening's not for everyone, but we have to take a look because it's not always the best option for some people. For those who have maybe a faulty restoration or recessions where their gums are higher than they should be, cracks in the outer surfaces of your teeth, loose teeth, or tooth sensitivity, which is a major problem for some, but we do have solutions for that as well. However, whitening is good for removing most stains inside of your mouth.
So when it comes down to whitening, what are the advantages and disadvantages for me?
Okay, with every procedure there's advantages and disadvantages, and we had talked about your sensitivity earlier. Mm-hmm. So with whitening, a disadvantage would be that it would increase the sensitivity, okay, and you might feel pain. Okay. There is certain products that we can use for that, but again, we have to be careful about the sensitivity. But there's always advantages of whitening, mm-hmm, which is a brighter, wetter smile and leads to more confidence.
Okay. So what factors are going to affect the success of whitening treatment though?
Okay, there's a lot of factors that come into play with the success of your whitening. So initially you may notice that you have a really bright smile, but over the course of a few days you might go down a few shades according to the shade guide. Mm-hmm. And a lot of the times you can maintain it by using whitening toothpaste and whitening Listerine and things like that, as well as trying to reduce the amount of caffeinated drinks that you have, or things such as wine or food such as blueberries, which can induce more stain on your teeth.
Okay. What are the steps involved with whitening? I'm not really familiar on them.
Okay, so initially what we do is we take what's called an impression of your teeth, and we do that so that we can make a custom tray fit to your mouth. So what we did was we take an alginate impression and we pour it up to make a stone such as this. And then we use a whitening material and we have it form fit so that we can make a custom tray that will follow your gum margin so that you won't get redness or sort of inflammation from the whitening product.
And would these fit exactly to my teeth? Would it go up on anything? Would I get sensitivity if I use this type?
No, you wouldn't have gum issues, but if you were to get it on your gums, mm-hmm, we do have products that will desensitize or reduce the swelling and inflammation.
Okay, I have been told that in-office whitening is actually really expensive, and as a student right now, is there any other options that I can do instead of in-office whitening?
What we can do is we can make these trays for you, and what happens is we give you the whitening treatment to take home with you. So okay, that's more of a cheaper option for you as well. Okay. And so what you would do is we have this product here, and mm-hmm, I'm just going to open it up to show you. Okay. So you would take this, and you would only place a pea-size amount on each little piece area of your teeth, and you would only go up to about this tooth here because you don't really show these back teeth. Okay. So what you do is you place each drop here, and then you place it in your mouth and hold for 30 minutes.
Okay. So other than the take-home option, is there any other options for out-of-office whitening?
There is. There are some over-the-counter products such as Crest White Strips. Okay. The only difference is that the Pol-A-Day that we give you for an out-of-office is a 9.5% hydrogen peroxide solution. Mm-hmm. So because if you have a lot of tooth sensitivity, mm-hmm, it may affect you more because of that, whereas the Crest White Strips have a lower percentage of hydrogen peroxide. What we can also do is give you an at-home treatment that is called carbamide peroxide. And so that actually was good for teeth that are very sensitive, and you had said that you were experiencing some sensitivity, mm-hmm, so I think that's the best option for you. With the Crest White Strips though, some people have some issues because they're not custom fit like the whitening trays are to your teeth. Okay. So what happens is that with this, I'm going to open a strip for you, okay, to show you, is that this strip, mm-hmm, goes on directly onto your teeth, but the problem is that it's touching your gums, so you may experience pain. Okay. And a lot of the times, because this solution is hydrogen peroxide, people experience sensitivity before they can finish the treatment. Okay. But it is a cheaper option for you. Okay. This runs anywhere from $40 to $70 over the counter, where our take-home is around $400, versus the in-office, which can be anywhere from $600 to $800. Okay. Comparing the out-of-office whitening, how long do they each last? Okay, so with the take-home that we're going to have with the custom trays, it'll require 1 to 2 touch-ups a year. And you notice that you might go down a few shades if you're drinking a lot of caffeinated beverages like we had said before, or you're eating a lot of foods that'll stain your teeth. But you can, like I said before, you can use the maintenance products such as the whitening toothpaste and the whitening mouthwash. Because you want to go up a few shades, you will notice a reduction in whiteness.
Okay. With the whitening strips, how long is that guaranteed for?
Okay, well, with the white strips, the problem is a lot of people are not able to finish because of the sensitivity. But with that product, it requires you to use it more because it's a lower solution.
With the whitening strips, though, is it possible to be able to cut them to fit around your teeth, or?
A lot of people do try that, but it is quite difficult, and they may find that the custom tray is a much easier option for them.
So what are the adverse effects that I can experience going through this procedure of whitening?
So what happens a lot of the times with most whitening products is called thermal hypersensitivity. So it's generally sensitivity to hot and cold. And because you experience already, it's going to increase it even more to maybe a really painful. So we have products that can decrease that sensitivity, or we suggest cessation of the product for a while. There's also things such as irritation of the gums, and that's in case you put too much product and it leaks onto your gums, or if you use something like the Crest White strips, which do not follow the margins of your gums.
So when it comes down to it, thinking about using at-home whitening strips and using these custom models, even though it is more expensive, I do experience a lot of sensitivity, and even talking about how these will fit better and I'll possibly experience less sensitivity, and so that you can provide me with something that you can put over for sensitivity around these trays, I think that's really great, and I really think I want to move forward with this option, and I would love to book an appointment to be able to get these trays made.